I'm Dennis Anderson along with Julie Zenner, and here's what's coming up on Almanac North.
9 healthcare providers in northeastern Minnesota have joined together in a partnership called Wilderness Health. Leaders of the new collaboration say the goal is to improve patient care.
Well, the Department of Transportation has picked a preferred route for the Highway 53 Relocation project. We will talk with MNDOT's project leader about this decision.
And we'll have the latest business update and a story that was making news 25 years ago.
So stay right where you are. Almanac North is next. Hello and welcome to Almanac North. Thank you very much for watching. This show was recorded on Wednesday afternoon. It has been a busy week around here, Julie.
A very busy week, but Friday night off, so that's good.
There you go. All right, now let's introduce our first guests.
All right, thank you, Denny, and welcome everyone. A group of 9 hospitals in northeastern Minnesota have formed the Wilderness Health Partnership. While the 9 hospitals will remain independent, they will work together on patient care issues to help improve overall quality of health care in the region. Joining us now is Cassandra Beardsley, Executive Director of Wilderness Health. Mike Delfs is CEO of Mercy Hospital in Moose Lake and Vice Chair of Wilderness Health. And Greg Ruberg is Administrator at Lakeview Hospital in Two Harbors, another member of Wilderness Health. And welcome, thanks for being here. Really appreciate you coming in.
Thanks for having us.
Cassandra, Wilderness Health has been in the planning stages for some time, but can you kind of talk about what those forces were that really drove these hospitals to come together?
Sure. The group of hospitals has been meeting for many years informally, and last year decided if they were going to move anything forward together that they needed to really have somebody in charge of it. And so that's where I kind of came in. And there's a number of forces that really caused the group to say, let's actually do something. Medicare has been continually reducing the amount of reimbursement for all hospitals, really. There's penalties rather than incentives for quality care. And then the critical access hospitals had a reduction from the sequestration that was enacted a few years ago, reducing the amount of reimbursement that they had as well. And some of the other payers, commercial insurance payers, have followed suit with those reductions. And so the group said, you know, we're continuing to see smaller and smaller reimbursement. Our costs are not decreasing. And so we need to do something different and work together to be able to sustain our operations.
Mike, you're from Mercy Hospital in Moose Lake. Why did Mercy decide to go this route, and how will you benefit from it?
Well, we're a critical access hospital, and one of the things that we find is that because of the decreased reimbursement, we have to get more and more innovative in the ways that we do things. The other thing that I would say is that one of the main tenets of healthcare reform really is reduced cost while maintaining the same level of quality. That's one of the main reasons our hospital became involved. It really allows us to work collaboratively as independent hospitals and manage to do things more efficiently than we could simply by ourselves.
Now, the word reimbursement has come up a couple of times. Will it be easier for the hospitals to really negotiate from a stronger position together as far as those reimbursements for Medicare and Medicaid and even with private insurers?
Oh, I think that's something that we're going to explore, but to be able to do that, you have to prove that you have a product that you're offering, and so that's where we're really going to be focusing on our quality and our outcome improvement. Being able to show that you are doing good things for patients and having good results is going to be key to having those conversations with any of the payers.
So, Greg, how will smaller outlying hospitals work with the Wilderness Healthcare Plan? What will Wilderness do for example, your hospital?
So one significant benefit for our hospital in Two Harbors is we can share best practices. So we can discuss what Mercy is doing, what's worked for them, what their challenges have been in the past, and how they've tackled those. So for a small hospital that doesn't have a lot of resources, we get the benefit of larger organizations that are similar around the region.
Could you also share physicians and or nurses?
We have not done that at this point. Maybe in the future it could be a possibility.
So this isn't a merger per se. It's more of an affiliation or a collaboration. How will those relationships work? Is St. Luke's being the largest partner in this, will they oversee things, or is everybody equal?
Well, what's interesting, and one of the reasons why I think a lot of small hospitals have become interested in Wilderness, is that as we sit at the table, we all have an equal vote. As we begin to plan out how will this organization develop, and I would say it's the graciousness of St. Luke's, they are the largest partner, which means that financially they're the largest contributor in terms of resource and dollars. But what it really means is that as independent hospitals, we get the opportunity to think about how do we work together while maintaining the independence? How do we make sure that we tie our resources together? This goes to the bottom line. It goes to do you buy things more cheaply? Can you figure out how to do things better?
Yeah.
And probably most importantly is, can you care for patients across multiple organizations? People move around. People have lake cabins. One of the goals of the group for the future is really, how do you care for patients when they're seen in other settings? How do you know what went on with them?
Any and all of you can answer this. Aside from the obvious, which is hospitals providing health care, what else does a hospital do for rural Minnesota, for each community?
Well, most of our hospitals are critical access hospitals. 7 of the 9 are. And even St. Luke's and Fairview Range up in Hibbing are very large employers in their community, and critical access hospitals are usually one of the largest employers in a community, if not the major employer, one of the top 3. So making sure that we're maintaining those facilities to be able to not only maintain our populations in our communities, but attract new businesses and retain and attract new people to communities is really critical.
I would echo that
Please.
in that when you begin to look at economic development, there's usually a couple of things people look at when they're going to move to a small town. First, they have to have a job that they're going to go to. But over and above that, generally they want to know, if they have school-age children, what are the schools like? And they want to know, what's my health care going to be like? Can I get it locally? Do I have to drive for it? So small hospitals, in particular in small towns, can be a real economic driver of the community.
And Greg, small hospitals save lives.
They do, and I think for us the benefit of this collaborative is that we can assess somebody in our hospital and get them quickly transferred down to St. Luke's for a higher level of care. But we can stabilize them and transfer, whereas if they had to make that drive in the winter on icy, snowy roads, it's much more difficult.
One thing that seems to be coming up more and more in rural hospitals is the whole transition to electronic health records and electronic medicine. Greg, how is the region doing in terms of really having the infrastructure in place to do that effectively?
I think we're making progress. I look at this collaborative as one more step toward a more integrated health record. Right now we are integrated with St. Luke's with the health record, so we see a pretty smooth transition between the two organizations. That's not always the case. When we refer a patient out somewhere else or they come into us, that's not always smooth.
So could, in theory, doctors or surgeons from St. Luke's be doing some telemedicine then with the hospitals within the system? If you started talking about that?
We're going to start taking a look at those opportunities. And as the infrastructure has become more developed within the rural communities, that's going to make it a lot more easy for us to be able to take a look at equipment and being able to provide those services remotely, so that we don't have to send a physician on the road and take them out of the office and not seeing as many patients, or take that person out of their community and having to travel several hours for care.
Is this the move of the future? Do you see other hospitals maybe coming aboard? Or are there other plans like this around the country already?
It's pretty unique that that people stay independent in a relationship. A lot of times it's a merger acquisition type of deal, but there are probably a few. But in Minnesota, this is the one that we're most aware of, and for so many rural hospitals to be involved is rather unique.
Okay.
And Mike, at one point, Moose Lake had an affiliation with Essentia that didn't quite work out. How is this different, and what were some of the challenges in that relationship that maybe help you moving forward into this one?
Sure. I would identify the main challenge as something we've been talking about. It was very clear when the hospital board and the hospital began to explore a relationship. It became very, very clear that the community felt strongly about us remaining independent, which is why this is so attractive to us as a hospital. Going in, the premise is you remain independent. You're working with like-minded independent hospitals. What this brings to the table, though, is a level of resource, and Greg maybe said it best. we have the opportunity now to work with multiple hospitals to figure out what's the best practice, what are you doing that works that we're not doing, and vice versa. It really allows for a collaboration, which is very different. When we had originally been talking with Essentia Health a while back, that was really more of an affiliation.
Right.
And that's very, very different. That implies less independence, and it implies a much closer relationship with a large system. And again, our community was very clear. They wanted an independent hospital where they had a say about what goes on there.
So will the Wilderness Board then, with members from each of the member hospitals, meet fairly frequently then to keep tabs on what each other is doing and what help you may need?
Yeah, we have a couple different committees set up. We have the board of directors, which meets every month, and every member is invited to attend. And because we are spread out so geographically dispersed, it's probably 12 hours if you were to just drive between all the different facilities. We have a lot of our meetings remotely. We're a virtual system, and so we do webinars and conference calls a lot, but we do try and get together several times a year in person as well. We also have a quality committee made up of physicians, nurses, quality analysts. It's a diverse, multi-diverse committee that meets and is going to be working and looking at quality measures and where we have some opportunities to make improvements in care.
This looks and sounds like a way to keep small town hospitals alive.
Exactly.
That's
right.
absolutely the intent.
Yeah.
It is.
And provide very high quality care in a cost-effective manner.
Because we've all heard of stories of smaller hospitals that have had to fold over the last 40, 50 years. They just couldn't do it alone.
Right.
Exactly.
Yeah, and that is one of the tenets of healthcare reform. One of the basic tenets is how do you do more cheaply high quality care? And that really is one of the things that I think this organization has the potential to just hit it out of the park on.
Greg, has the Affordable Care Act improved the quality of care or access to care in the rural parts of our region?
We're working that way. I think this collaborative will be a very positive step in that direction. Again, I think the coordination of care has to improve, and that's what this group is looking to work on. So that if somebody comes in our door, we have very clear, smooth coordination of care. If they go to a Duluth hospital, if they come from Mercy in Moose Lake, the same thing will happen. So quality has the potential to improve. It's still disconnected, though. There's still work that needs to be done.
Do you see individual patients seeing a difference in their healthcare experience because of what you're doing as a system?
If you go in tomorrow, you don't make an appointment with Wilderness Health, you make it with your regular doctor, but over the long term, we're taking a look at quality and benchmarking that and finding out who's doing something that's just so fabulous and how can we replicate that so that everybody has that beneficial experience and just trying to find best practices and incorporating that throughout our area.
So they'll be sharing best practices between the hospitals and what's working, what's not working, and that dialogue can make things better for folks.
Yep, we're also taking a look at a data analytics system so that we can identify prospective patients who might be at risk for certain high-cost conditions or gaps in their care so that we can take better care of them before a hospitalization occurs.
And are there other hospitals in the region or healthcare facilities that are interested in joining now that they see that you've got a pretty cohesive
I think
group?
that there might be, and we certainly would welcome others to have that conversation with us.
Down the road, there may be a lineup.
There might be, yeah.
Yeah, we do have a few organizations who are saying, well, let's see what happens in year one because we have an interest, but we want to see what direction you're headed and what you're doing.
Good.
Yeah.
Well, that's all the time we have, but thank you for
Great
coming in and
discussion.
sharing information.
Thank you
Sounds
very,
like a
very
very
much.
Thank you
interesting
so
thing
much.
that you're doing. Good luck with it.
Thank you.
Thanks.
Let's dig into our news file archive for a look at what was making news 25 years ago this week.
After nearly 30 years of planning and development, litigation, and lots of hard work, Interstate 35 through part of the downtown area is complete today. Though it won't officially open until next Tuesday, many of the people involved in the Mammoth Project held a celebration of praise high above the interstate.
It joins together the waterfront and the downtown, the waterfront and the community, and does it in such a spectacular fashion that is probably going to be one of the finest urban renewal projects, downtown development projects anywhere in the country.
Engineers and others who helped construct this section of the extension will tell you molding tons of concrete and steel was no easy project.
We had problems, everything from a bottomless swamp to solid rock. I think we've had just about every kind of engineering problem that you could have on a short stretch of highway.
Part of the praise also went to motorists who endured the dust, the detours, and the distraction of traveling on busy downtown streets. Part of the detour will continue. Beginning Monday, Superior Street will be blocked off from 10th Avenue East to 12th Avenue East. Eastbound Superior motorists will need to use 2nd Street. John Gagnon, KDLH News.
A preferred route for the Minnesota Highway 53 relocation project near Virginia has been chosen. The Minnesota Department of Transportation announced this week that the E2 option makes the most sense. It's the northernmost route and includes a bridge across the old Richelieu Pit. Rerouting the highway is necessary due to an agreement with Cliffs Natural Resources, which plans to mine ore beneath the existing highway. Now, here to talk about this preferred route is Pat Huston, MNDOT's director of the Highway 53 relocation project. Pat, thanks for being here. This has been a long process. What makes E2 move to the top of the list?
A number of things make E2 move to the top of the list, but maybe before I talk about that, I want to say it's a recommendation, it's a preferred alternative. Mm-hmm. So we are in the midst of an environmental process, a draft environmental impact statement, and that will continue on, hopefully best case scenario, through next summer and late or early fall, at which point we could go to construction. So my point being, I want to make it clear, there's all three of our build alternatives, M1, E1A, and E2 are in that, as well as two no-build alternatives that basically close the highway and sign over to Highway 7, as well as what we call the existing Highway 53 option, which would be buy out the existing area. So all those are equally considered.
But this is the one that you think makes the most sense?
So this is the one that, from an engineering perspective, we think makes the most sense. So from many technical perspectives, our functional experts on the project team, be it our bridge experts, environmental experts, our right-of-way land management folks, a number of them have done a lot of studying on this, and we asked them, with the project goal to meet that schedule, which is currently on the books of May of 2017, look at your particular area, bridge for example, and make a recommendation for what makes the most sense for your functional area, considering the pros and cons and all of the risks and how would we mitigate those risks. Yeah. And so we did that with all these different areas and had a workshop along with our leadership at MNDOT. And on technical merits and considering social and environmental and economic impacts, E2 made the most sense. And that was before cost was considered. So we didn't share cost with our technical leads. And when cost component was added in, that even added more credence to the decision.
We have a graphic up on the screen right now, and maybe you could take a look at it and talk about how the option that is preferred maybe rose to the top over the other ones that are shown there.
Okay, so what we see on the screen are what we call the three build alternatives, and they are M1, E1A, and E2. M1 goes through the existing United Taconite mine. And early on, before I was on the project, that looked very promising. And of course, as many things in life, the devil's in the details. So there's many challenges with M1. Among them, it covers a lot of ore that's still down there. We call it geotechnically the engineering word for the soil that's supporting whatever we build. There's issues there with some very soft material down there. Part of the roadway fill is almost kind of there because at the time it was thought a good idea. The mining company was placing fill there. But of course they don't do that the way we build roads and what's underneath there. Also a challenge, the two orange lines are bridges, and those bridges would be needed so that their equipment could pass underneath to mine to the east.
I see, okay.
So a lot of challenges constructing those bridges. And then of course, Now we're putting public traffic in an active mine. So that creates a lot of challenges there. And this large earth fill would be quite tall and reinforced with, actually, we call it geogrid. It's a kind of a plastic waffle cone type material. Again, very challenging construction and concerns for settlement. So at a high level, those are the issues with M1. When we move over to E1A,
That looks like a long build.
that is a long build. So initially the idea where you see the orange line, underneath there, of course this is an old mine called Richelieu Pit, and there didn't used to be water in it when it was being mined, and in order to get the ore out, there is an underwater, we call it the underwater haul road, that is basically under that orange line. And so the initial thinking was we could build an earthen fill up off of that. The water is only currently 30 feet deep over that. But again, very difficult for us to test and have a high level of confidence. We did a lot of testing on that route, but there's a lot of, from Volkswagen-sized rocks down to very fine material, sand and silt-like material, down to the hard rock, and it's inclined. And so it's just very hard to quantify, and if you can imagine putting 170 feet of earth on top of that, very difficult. And again, it's a little bit closer to the mining operation. So from that idea came, this is a struggle. There's a lot of unknowns with this and uncertainties building up a large earth fill. Led us to look at the bridge option, and as we investigated more, certainly there's some challenges with that, but less unknowns to the fill option. So these things were all still in play. But if you can imagine what we call bridge piers, they're supports that hold up the bridge, having to get 8 of those in the water from a barge down through material that we know something about, but you can't drill everywhere, and we're currently testing going on there. A lot of challenges. The benefit of that route is it's the least amount of minerals. It's by and large been mined out. There are still some minerals along that corridor. Whereas E2, a shorter bridge, 1,000 feet long.
But that won't necessarily mean an easy build, will it?
No, not an easy build, but on E2 we have a bridge that's a third of the length. Still very difficult, a very tight gorge there. Our 2 supporting piers we think can be constructed out of the water, still challenging. The roadway where it's on the normal earth is not challenging construction, but one of the major drawbacks over there, it is over a mineral reserve. And so one of our key project goals is having a permanent easement, and we are negotiating with the landowners and actually both landowners for a permanent land easement, and we would have to compensate them for the minerals underneath that road. So
would this ever be selected if that easement couldn't be put in place, with the prospect of possibly having to go through the whole thing again 40 years from now?
Nobody's interested in going through it again. So we've been working very hard with the landowners and the mine operator. It's been a good working relationship, and we're confident we can get to the end of it. So a lot of that groundwork has been laid.
Pat, you've got some public meetings coming up?
We don't. Monthly we have on the first Thursday, we have coffee and conversation. This week we had the public announcement for that preferred alignment recommendation, and we announced that we received a lot of support through a series of meetings, both the public, the media, local legislators, and project stakeholders.
What are you hearing from the folks in Virginia? Are they pretty much in favor of E2?
They are. They're glad that we're moving forward, but we're taking a step back for a short period of time. I don't know how long, just to make sure we give some time after the announcement for comment. On our project website, there is a spot where you can provide comment. And the schedule is very, very important on this project. That's right around the corner. But even more important, most important, is that we do this right. And we heard that from our Commissioner of Transportation, Commissioner Zell, yesterday. So that's why we're taking a step back and providing some avenues for some feedback. But in person, we heard a lot of support.
And even if E2 is given the final green light, we're still talking a year out before construction begins.
Best case scenario. So as we go through this process, in the environmental process, and maybe I just back up, the environmental process is somewhat of a misnomer. We call it the environmental impact statement. It's not just environmental, and that's one thing I think it's really important for people to know. It considers social, economic, and environmental impacts. It's not just purely environmental.
Sure.
And all these things for the 5 options, 3 build, 2 no build, are being considered. So that's really key. But to answer your question, Denny, to stay on the schedule, we're assuming we're taking additional commitments on. So for example, even though we're not through the process, next July, in order to build this bridge close to on schedule, we would have to order steel for it if it's a steel bridge,
exactly.
because it takes 10, 11 months to procure that.
And Pat, with that, we have to run. Want to thank you very much. Time is short. All the best.
Thank you.
Pat Huston from MNDOT. Thank you.
Here's a look at the week's top business stories from the editors at Business North. A long-standing financial relationship between the Superior-based Development Association and Douglas County is changing. The county board has decided not to fund the development group in its 2015 budget. The county's contribution was to be $25,000, about 1/10 of the group's budget. County officials said there has been a lack of communication with the development group, which Executive Director Michelle Hostetler denies. She said an all-private funding model would better serve development efforts.
Although the job of Iron Range Resources and Rehabilitation Commissioner is a political appointment, Minnesota Governor Mark Dayton has decided to accept applications from the general public. The position will become open January 1st when Commissioner Tony Sertich begins a new job as Northland Foundation president. Individuals who would like to be considered for this position must submit their application to the governor's office by December 1st.
Wisconsin's top workforce development official was to visit Superior Thursday to gain perspective about education and training efforts. Before a lunch address to chamber members, Secretary Reggie Newsom was to visit Charter NEX Films to review the company's training and advancement program. Later, Newsom was scheduled for a tour of the WITC campus and to meet with campus and system administrators. Workforce development is an increasingly important issue, with companies nationwide saying they're unable to find enough qualified workers. For more on these and other stories, visit businessnorth.com.
So if you have a comment on our show, give us a call. Dial 218-788-2849 to leave a message or send an email to Almanac North at WDSE.org. You can also go to the WDSE website for program updates, news at the station, and to find out about public TV events in the community. And Julie, I'm looking forward to some warmer temperatures this weekend.
I don't know. I feel like we're halfway through January already. It is just brutal out there.
Oh, we've got a ways to go, don't we? All right, for Julie and the crew at Almanac North, I'm Dennis Anderson. Have a great weekend. Good night, everybody, and be kind.